morning everyone. My topic for presentation is non-surgical approach to orbital veno-lymphatic malformation. Lymphangiomas or veno-lymphatic malformations are multicystic localized malformations that involve the lymphatic and the vascular systems, mostly occurring in the head and the neck region. Currently, on classifying based on the size of the cyst, lymphangiomas are of three types: microcystic, macrocystic and mixed. Now currently 4 categories of management options are available: observation, intralesional sclerosing injection, systemic medication and surgery. Observation is done for smaller lesions. Situations like diminution of vision, mechanical ptosis or cosmetic concern becomes indication for other modalities. Since these lesions are ill-defined, cursor is not working.
It is working. It's too much sunlight, you can't see, that is the thing.
There are risks and benefits to all 4 treatment types. Injection bleomycin can be a non-surgical option where directly lesion can be targeted. Also, very few studies are available where the treatment outcomes has been studied with bleomycin. So, purpose of the study is to assess the clinical presentation of orbital veno-lymphatic malformation patients and evaluate outcomes of injection bleomycin. So, coming to the material methods, this was a retrospective interventional case series of 7 patients who was administered injection bleomycin. These are the pre-operative clinical photographs of the patients. So after general systemic and ocular examination, clinical presentation, location and post-injection bleomycin outcomes were assessed. Outcome evaluation was done on the basis of improvement in the gross clinical appearance and patient satisfaction was noted. Diagnosis of veno-lymphatic malformation is based on the clinical radiologic findings and supported by aspirate cytology. Here in image B, we can see T1 weighted contrast enhanced MRI scan of the patient showing significant proptosis of the left eye containing multiple cysts with fluid levels. Now in this image, here we can see multiseptate large cystic lesion inferiormedially with heterogeneous contents. In this case, image B is showing proptosis of the left eye with fluid level in the retrobulbar space, which is pathognomonic. Now in this image, we can see proptosis of the left eye containing multiple cysts, again with fluid level, with thin enhancing cyst wall in the retrobulbar space. Thus, based on the clinico-radiologic finding, patients were planned cyst aspiration with injection bleomycin. Reconstituted bleomycin is made by adding sterile water to 2% lignocaine in the ratio of 1:1 and dose of 0.5 international units per kg body weight per sitting was given. 20% of the aspirate amount was administered and injections were repeated every 4 weekly whenever required. Bleomycin acts by irritating the endothelial lining, causing inflammation and involution of the lesion. Here is a small video demonstrating the procedure. Under all aseptic precaution and imaging guidance, 26-gauge needle is inserted in the cystic lesion and the content is aspirated, keeping the hub of the needle stable. Syringe is loaded with reconstituted bleomycin. Now coming to the results, out of the total samples, 71% were females, age range from 2.5 years to 20 years. Macrocystic is the most common variant and orbitopalpebral is the most common location, and almost all cases presented with lid swelling and proptosis. 2 patients presented with ocular motility restriction. And to sum up the treatment, 2 sittings of 8 international units of bleomycin was required, resulting in 82% reduction in the original cyst volume with 3.3 millimeters mean reduction in the proptosis with nil systemic and minimal local side effects, including swelling and subconjunctival hemorrhage and no recurrence at 6 months follow-up. Now coming to this discussion, similar study was done at LVPI where the lid swelling and proptosis were common presenting features, though common variant was microcystic. 3 sessions of intralesional bleomycin were given and outcomes were similar to our study. Similarly, Shankar Netralaya, Hyderabad reported 60% reduction in the mean volume of the lesion following 2 sessions. These are the pre-injection, post-injection photographs of the patient. Now coming to the conclusion, orbital veno-lymphatic malformation mostly presents with lid swelling and proptosis. Injection bleomycin is easy to inject and avoids post-surgical morbidity. A mean of 2 sessions are required for significant reduction of the lesion. There is quick post-op recovery with minimal systemic and local side effects with no recurrence. My take-home message is all variants of veno-lymphatic malformation can be successfully treated with intralesional bleomycin with nil systemic and minimal local side effects with near total resolution of the lesions after 2 sittings. Thank you.
Thank you. All variants can be successfully treated
Yes, ma'am.
because there are some
Yeah.
of the posterior variants.
Yes, ma'am.
You can successfully treat
Ma'am,
it.
success in the terms we can achieve maximum reduction, more than 80% reduction in the clinical as well as radiological appearance we can see.
What imaging modality you took?
Ma'am, MRI.
No, I'm telling about during the procedure, what imaging
Ma'am,
modality?
actually it was done keeping the MRI, considering the MRI features,
in
but
none of the
ultrasound-
cases you
ultrasound
took
guided was not done.
not done. So you cannot go very interior limits. It's an intraconal or
Yes.
the retro orbital means it is a very deep seated. You cannot do that.
Yes, ma'am.
So in those cases you may have to do it under imaging guided, USG guided
Yes.
or CT guided.
Yes, ma'am.
And in some of the cases, I don't know, but some of the cases you may have to do surgery also later anteriorly because you can do combined. You can combine
Yes,
it.
ma'am.
The
Usually,
more anteriorly located things that you
Yes,
can do surgery and the
yes, ma'am. The modality of treatment we use depends on the superficialness of the
Okay.
lesion.
Okay.
And
Good.
as well as we can combine surgery along with sclerosant agent.
yes. Thank you.